Scrapes and cuts are part of everyday life and can be treated at home with over-the-counter supplies and medications. Gently cleaning with tap water and soap, covering a cut with a clean bandage, and applying pressure will stop most bleeding and manage many wounds. If the cut is wide or gaping and you are not able to put the edges together, or if bleeding continues after applying pressure for 5 minutes, it's time to seek medical attention. If there's an object inside of the wound, do not remove the object. Cover the wound with a clean cloth, apply pressure, and allow a doctor to remove the object and treat the wound. If a cut is bleeding profusely, there is a chance an artery was cut. Cover the wound with a clean cloth, apply firm, steady pressure, and elevate the affected area and head to your nearest urgent care center or emergency room. Other wounds that require medical attention are those caused by an animal bite, a contaminated or rusty object, or contain debris. These cuts are at risk for bacterial infection, tetanus, or even rabies, and may require specialized care. At Texas MedClinic, we treat cuts, wounds, and you well.